HRT, hormone replacement therapy. That's what HRT stands for. TRT is what some guys talk about, and that's testosterone replacement therapy. But we want to look at the big picture for males and females. What is hormone replacement therapy? This is when a male or female's hormones are declined, deficient, right? And they need to replace those hormones because they're probably feeling some sort of symptom, whether it be energy, libido, concentration, motivation, right? A lot of different things that you might not think you're feeling right now that could benefit you with hormone replacement therapy. So, hormone replacement therapy, how do you find out if you need hormone replacement therapy? I got that question today. I actually had some person that was on a live last week come into the office and say, I seen the Instagram live. I had a couple questions. Little did he know that I was going to be the one to walk out there and to answer his questions. And he was like, wow. He's like, I didn't think I was going to get you out here. Well, I was there to answer his questions. I was here. I was like, I might as well do it. The girls are busy helping other patients. Why not? So let's get into this. So with hormone replacement therapy, the best way to know if you need it or not is to blood test. Now, blood testing, you say, well, I get a blood test every year from my doctor for my physical, and he says everything's fine. So what test is he actually running on you? That's the first question you need to ask. And usually, those tests that they're running on you are like a CMP, so a comprehensive metabolic panel. They're checking liver, they're checking kidneys, they're checking electrolytes through there, a complete blood cell count, red blood cell count, white blood cell count, hemoglobin, hematocrit, checking for infection, anything off there. No. Cholesterol, they want to see a lipid panel, so HDL, good cholesterol, LDL, bad cholesterol, where you're staying in triglycerides, they look at that. Sometimes they'll look at a thyroid panel, it just all depends. Usually, other than that, they're really not looking at your hormones. Free and total testosterone ranges, estradiol or estrogen ranges, progesterone ranges, IGF-1 ranges, insulin growth factor 1, very important, or some potentially essential vitamins like B12 or vitamin D, which is actually a hormone and not a vitamin. It's really, really funny they call it that, right? But it is. It's really a hormone. So at that point, really breaking down and checking for some of the necessary things that might be going wrong in your system right now that you guys can fix that might not be looked at by a primary care physician. So this is the first step, to blood test. Now, how easy is it to blood test with Titan Medical Center? It's so simple. All you got to do is call or text 727-389-3220. We can set you up with blood work in your area, in your zip code. So you don't actually have to travel to Titan Medical Center. You don't have to come to Florida. We can send you to a lab in your area, right? It's real simple and real easy. All you do is call. We get some information. We send you a slip via email. You go in with this slip. That's your form of payment. You don't got to pay the lab any more money or anything like that. They're going to draw your blood. We're going to get your results automatically, real quick, within 48 to 72 hours, usually 2 to 3 business days. They want me to say 3 to 4 out there, but that's really what it is. So when we get those results back, we call you, we give you a little briefing on it, and we get you set up with a medical provider to go in depth through these blood results if you want. Make recommendations on how we can help you or what your goals are, and that's what it is. So it's real simple and real easy to do, guys. So all you have to do is do that. Then at that point, we know where your hormones at, how we can help you out, what we can optimize, and where you stand, okay? So it's always good to find these things out. Now, with women, you have all different types of hormones, but you have the exact same hormones as guys. Guys and girls have the exact same hormones, just at different levels for these different hormones. And that's where it really makes the difference. And when you optimize the hormones or get them back to where they need to be, everything really starts to fall in place. Like concentration, energy levels, libido levels, motivation, these things that you were missing out on, and possibly boosting the metabolism, better cardiovascular. So you're going to get a lot of different health benefits out of it too as well when you have everything in your system working like it should, okay? And that's really the main point is getting everything working optimally and getting everything working the way it should, okay? So that's really where it's at. Peptides. Now there's different peptides we offer. We offer healing peptides, weight loss peptides. There's peptides that will, as far as making anti-aging purposes, that's another good one. We have ones that are great for sickness or getting over viral infections. That's another big one, like thymosin alpha 1. We have BPC 157, TB 500 for healing. CJC 1295 with Emperellin, MK 677. These are GHRH, growth hormone releasing hormones. One's oral, the other one's injectable, and they work a different way, right? But they get the same good result for you guys. So these are just some of the different things that we have in our arsenal to help you guys get the results that you really want, okay? Plus all the vitamin amino acid injectable therapies, you can't